When you're going to monetize your practice, essentially what you've done, and we talked about this in previous articles, is to kind of select your niche. Let's choose thyroid as your niche today. So if you're going to be a thyroid doctor, right, you're going to bring people into your office to treat them for thyroid conditions, you essentially need to go through a few steps, and everyone's going to do this a little bit differently. So the obvious things to monetize in your practice for a thyroid patient are going to be the exam, the test results, and obviously the supplementation that you might sell them. But on the other side, okay, so what are the question that you want to ask yourself is, for my typical thyroid patient, what else are they buying out there? Okay, so when I tell them, okay, hey, you need to be on a thyroid specific diet, am I handing them that diet? Am I giving them that diet? And if I am giving that diet, what am I charging for that diet? What am I charging for that advice? So that's the question that you want to ask. So in a typical kind of maybe naturopathic office or even a functional medicine office that isn't optimized, you're going to bring someone into your office and you're going to sell them essentially your therapy. So maybe you charge $300 for an office visit. So they cost $300. They come in, you talk to them for a half hour, an hour, however long you do your visits for, and then they leave and you told them go gluten-free, go dairy-free, go grain-free, and make sure that you exercise properly and get enough sleep, right? So you've told them these things, decrease stress, whatever else you're adding in there. And then when they leave, this is what they have. So they have nothing, right? All they have is a $300 fee and the supplements you gave them. Okay, so then they go home and they're like, man, he told me to go gluten-free. I don't know what to do from here. And they're going to go home and they're going to start looking for a gluten-free book, right? They're going to be looking for a diet plan. They're going to be looking for someone to guide them through that process. So the question is, do you want to be that person that guides them through that process, or do you not want to be? And when it comes to those two things, you want to make a choice. Do I want to be the person that guides them through, or do I want to be the person that sells them the product that guides them through? So maybe inside your new patient package, rather than doing a $300 visit, it may be a $600 visit that includes the thyroid assessment, the evaluation, the lab tests, whatever it comes out to those, as well as a 30-day thyroid diet reset, if that makes sense. So what you're looking for is something that they were going to buy anyway that you can add to your package to where they can consume everything from you, right? Because I get patients that come in all the time and they bring a whole bag of supplements. What do you think about these 47 supplements? And I say, man, if I would sell them all 47 supplements that they take a month, I would be making a lot of money. Now, that may not be how you practice. Obviously, I don't really like my patients taking 47 supplements. We really simplify them down. But even if they took 10 a month, are they buying their fish oil from you? Are they buying their dietary products from you? Are they buying their protein from you? Okay, what can you do to monetize your practice? Or in other words, you're trying to be the one-stop shop. So when people get into looking at doctors, functional medicine practitioners, naturopaths, other chiropractors, you're not the only person they see. So if we were to take this maybe to a different example of like a chiropractor, someone comes in and they pay you your 30, 40, 50 bucks for an adjustment, and then they leave and they're done. Okay, but when they go home and their knee hurts, I promise you they don't call you right away, right? They're like, let me try some Icy Hot, let me try some BioFreeze, let me try something else like that. And once they try those things and they don't work, then they come back to your practice. But they did consume those things. So if you sell the most valuable knee rub, the most valuable anti-inflammatory turmeric, or whatever else however you want to monetize, you want to expand that. Naturopaths, functional medicine docs, we obviously know we sell products and supplement products, but the question is, what else can you add to your practice in order that they actually purchase it from you? And the reason why, so everyone's like, oh, well, that sounds pretty salesy to me. No, it's not salesy, because did you want them to go and buy the vegan diet? Because that one's on the grain-free vegan diet. Did you want them to consume protein, or did you not want them to consume protein? And they go and buy the carnivore diet, which is protein-free. So what you're doing, what they're paying you for, is the expertise to know which diet to follow. And then once you know what diet you want them to follow, you're selling them that product because it's going to get their results better. So it has nothing to do for the patient end with monetizing your practice, but they're going to buy it from somewhere. And once again, if they don't get their results with you, they're going to blame it on you, when really it could have been that they went home and they read a new fad diet and they started following it because it was grain-free and that's what you recommended, and they're not getting the results, right? So that's what you want to look at. Where are they going to buy something else that maybe